Hi, I'm Dr. Purnendu Gupta, Director of the Chicago Spine Center at Weiss Memorial Hospital. Our multidisciplinary team at the Spine Center has extensive experience in the treatment of complex spinal conditions. We know that if surgery is necessary, you may have many questions. It is very important for you and your family to understand and feel comfortable with all aspects of your procedure, including the risks, benefits, and necessary protocols for recovery. This will help you to be an active participant in your surgical preparation and recovery. Our online course is designed to help you understand your procedure, provide education on how to prepare for surgery, what to expect after surgery, and to learn about the support available for your recovery and rehabilitation. What sets the Chicago Spine Center apart is our dedication to high-quality care and personal attention to each patient's comfort and quality of life. Thank you for entrusting us with your care.
Hi, my name is Alan Given. I'm the Orthopedic Service Line Manager and Spine Care Coordinator at Weiss. My role as Spine Care Coordinator is to give you this preoperative education and act as your liaison for you with your doctor, the hospital, and your care team. I will round on you while you're in the hospital, and I'd be happy to help address any concerns you may have. The objectives that we're going to cover today in our course are understanding your procedure, going over pain management, recognizing and preventing complications, how to prepare for surgery, what to expect after surgery, physical and occupational therapy, and discharge to home. In preparing for surgery, we recommend that you review the patient guidebook for lumbar or cervical spine surgery that you should have received from your surgeon. It goes into much more detail than this course today. You should review it and bring it to all your visits with the hospital, your surgeon, or your therapist so you can go over any questions you may have. You can also call me or give the doctor a call if you have any questions.
I'm Cynthia Gonzalez, Orthopedic Clinical Nurse Specialist, and I will be going over understanding your procedure. The procedures I will be reviewing are laminectomy and discectomy, fusion, the use of bone graft, and instrumentation. As with any surgery, the goal with spinal surgery is to lessen pain and restore function. A laminectomy is the removal of a piece of the lamina to take pressure off the nerve. If you think of a roof of a house, the lamina would be the sides of the roof and the top would be the spinous process. Removal of that lamina ensures removal of pressure on a nerve or the spinal cord. A discectomy is the removal of a ruptured or bulging disc or disc material to decrease compression on a nerve. A discectomy can either be an open procedure or what's called a microdiscectomy. A microdiscectomy uses a smaller arthroscopic tool which makes a small incision in the lamina and removes any disc material that may be causing compression. A spinal fusion creates a bridge between two or more vertebrae. It is often needed if you are taking out bone that may potentially destabilize the spine. A fusion can be done with bone graft, BMP, bone morphogenic protein, or instrumentation. A laminoplasty removes pressure from the spinal cord, primarily in the cervical or neck area. A laminoplasty procedure is actually done by the physician making an incision on one side, opening the lamina and maintaining it open using sutures or wires. In spinal procedures, bone grafts can be used. This may be using donor bone or your own bone. If bone is being removed, it can be crushed or morselized and packed around the graft site. Hardware can include titanium or stainless steel rods, plates, or screws, and sometimes cages. A bone morphogenic protein is used and packed around the graft area to encourage the fusion to heal. After surgery, you will have some pain. Incisional pain, which can be soreness or pressure, can be treated with pain medication. Neuropathic or nerve pain, which is often felt prior to surgery, can sometimes worsen after surgery. This pain can feel like numbness and tingling, or radiating and burning pain down one or both extremities. This can be treated with medications, commonly anticonvulsants or antidepressants. Muscle spasms are another form of discomfort you may experience. Oftentimes, this may include a tight or grabbing sensation, especially in the area where surgery was performed. This can be treated with muscle relaxants. Remember, your pain may not go completely away, but we will make you as comfortable as possible. Our aim is to manage the discomfort so that you can eat, sleep, and move around. Nerve pain, which may be present prior to surgery, often persists after surgery, or it may temporarily feel worse due to manipulation of the nerve during surgery. We ask you, the patient, to assist us in intercepting your pain. Ask for medication when the pain starts to escalate. Please do not wait. Take your pain medication on a regular basis. Tell the nurse if the medication is not effective, and ask questions to be sure you understand the pain management efforts that are in place. As with any surgical procedure, there is always a possibility for post-operative complications. We do our best to prevent any potential complications. The potential complications that I will be reviewing include blood clots, infection, and pneumonia. In order to prevent blood clots, we use anti-embolism stockings, and we encourage early ambulation. In fact, the day of surgery, you may work with a nurse or therapist to move to a chair in a seated position and see if you can walk. You will definitely be walking the day after surgery. We also encourage you to do ankle pumps while lying in bed or sitting in a chair to help blood flow. Pneumonia is also a potential complication, which we prevent by providing you with an incentive spirometer. Our goal is for you to use this at least 10 times an hour while you are awake. You'll put the mouthpiece in your mouth and inhale deeply. When you inhale, the ball in the device will go up. You want to hold the ball up as long as possible and slowly exhale. Your goal is to increase the amount of time you can hold the ball up each day. We also encourage you to cough and deep breathe when you are in a seated position, breathing from your diaphragm. Infection is also a potential complication. After surgery, we will be monitoring your vital signs, and we request that you check your temperature at home as well. You want to inspect your incision. Your incision may have some redness. That's normal. But if you notice an increase in redness, any heat emanating from the incision, any drainage, or any fever, especially fever greater than 101 degrees, you need to contact your surgeon. Also, hand washing is very important when changing the dressing on your incision. Hand washing is important both before and after changing the dressing. Nausea and vomiting can occur after surgery, and we'll be medicating you for that to help prevent you from experiencing any discomfort. Also, after surgery, some patients experience abdominal distension. This is also called an ileus. To prevent this, we will start your diet slowly, usually with clear liquids. You will be receiving IV fluids after surgery, and again, we encourage ambulation to help prevent this.
A big part of your program is education, and another part is having a coach. A coach can be a family member or friend who shares the experience with you, and this will help you to optimize the outcome of your surgery. We encourage the coach to be involved with your care. All our rooms are private, so your coach is welcome to stay with you in the hospital while you're here. We also want the coach to learn what you're learning so that your coach can work as part of the team here at the hospital and help when you go home. We feel that every patient benefits from the assistance and motivation of a coach. Having a coach can provide confidence in knowing you'll have support at the hospital and when you go home after surgery. We found that having a coach can help lead to a faster recovery, help get you home earlier, and improve results after surgery. Your surgeon will go over your medications with you prior to surgery. We want to make sure that you stop medications that may increase bleeding 14 days before surgery. Some of these may include aspirin, anti-inflammatory medications, vitamin E in the pill form, and any kind of herbal medications in the pill form such as ginseng, garlic, ginkgo, cod oil, or fish oil. You should contact your prescribing physician about blood thinners that you were given to manage cardiac or other medical problems. It's important to have a discharge plan prior to surgery. These are details that we'll work on with you. Details such as having a ride so someone is available to drive you from the hospital. If you don't have transportation, we can help you arrange that. We recommend that you have someone with you after you leave the hospital for 5 to 14 days to optimize your recovery and make sure you're safe at home. Medical clearance is important before your surgery. We want to partner with your primary care doctor to make sure your health is optimized for the surgery itself. When you see your primary care doctor, you should go through any medications you're taking, and your doctor will complete all the recommended tests ordered by the spine surgeon. This may include lab tests, cardiac workup if indicated, or chest x-ray. All these tests would need to be completed prior to surgery. You will receive a call from hospital registration prior to the surgery to register you for the hospital. This call may come a day or a few weeks in advance. They will ask for all your basic information, your contact information, and your insurance information. The day before surgery, you'll receive a call from the surgery department to tell the time of your surgery. You should arrive an hour and a half before the scheduled surgery time to prepare you for surgery and start the IV antibiotics that will be needed. Please remember, you should have nothing to eat or drink after midnight the day before surgery. This includes water, ice chip, mint, gum. Nothing is to go into your mouth after midnight. We also want to talk to you about what to bring to the hospital. We want you to bring loose-fitting clothing, shorts, sweats, t-shirts, and walking or gym shoes. Patients having spine surgery may find that button-up shirts are easier to get on with the brace. We consider this a wellness program, and we want you to think of it as a program that's going to help you rebound and improve your outcome after surgery. A part of that is getting dressed in your own clothes while you're here at the hospital to help mentally get you back into the routine of what you will do when you go home. You can also bring a cell phone, an iPad, or a laptop, and the hospital has free Wi-Fi internet that you can access while here. We ask that you leave valuables and cash at home. Anything that you need while you're here, we can help provide to you. But we ask that you bring your health insurance card, your ID, and your credit card, as you may be asked for these when you arrive to check in at the hospital. Also, you may need these items at discharge, as we have set up a system with Walgreens so that you can order the prescriptions you need to take home and have them brought to you before you leave the hospital. You should bring your back or neck brace with you. This will be the brace that your surgeon provided to you or authorized prior to your surgery. When you arrive for surgery, you will come to the hospital's main entrance on Marine Drive. We recommend that you valet park your car if you drive. You will go to the main information desk, and they will direct you on how to check in. You will then go to the second floor, taking the A elevators to ambulatory surgery department. Once there, your care team will begin preparation for surgery. You'll change into a hospital gown, have an IV line inserted so that you can begin receiving an antibiotic to prevent infection. You may also get blood work and sign any consent forms or paperwork that still need to be done. This is why we ask that you arrive an hour and a half before surgery time. We ask your family or support system to wait in the surgical waiting room. The surgeon will come out to talk to them after surgery. You'll also meet with your surgeon, your nurses, and your anesthesiologist, and other members of your care team as you're being prepped for surgery, and have an opportunity to ask any last-minute questions. We may review your information again with you and your medical history, and you can discuss any pain management concerns you may have. Most people will have general anesthesia for the surgery. Some people find that after the tube is removed, they have a mild sore throat. This is normal. After surgery, you'll go to the recovery room where the care team will assess you to make sure you're doing well and help to manage your pain. After surgery, you'll go to the recovery room, where the care team will assess you to make sure you're doing well and help to manage your pain. The team will look at your vital signs, conduct a neuromuscular assessment, and check your comfort and your pain levels. At that time, depending on your doctor's orders, you may be brought to the ICU or to the spine center floor on the 4th floor, where you'll stay until you are discharged home. After the surgery, we focus on controlling your pain. Most people will also be connected to a PCA or patient-controlled analgesia, in which the patient controls their own medication and it is regulated by a machine that gives pain relief to the patient. We'll give you more instruction while you're here on how to use it. After your surgery is completed, the doctor may have you, with a nurse's help, turn side to side. We'll teach you how to log roll and the proper mechanics on how to do that. We may help you move out of bed into a chair or walk in the hallways. The day after surgery is called post-op day 1. If ordered by your surgeon, we'll take you off the patient-controlled analgesia or PCA pump, and you'll begin taking oral pain medications for pain. These pain medications will be taken around the clock for the first 24 hours after you stop using the PCA. We want you to understand that we need you to partner with us to manage your pain. We want you to intercept the pain before it becomes too much for your body, so that we don't have to play catch-up with your pain control. You should ask for pain medication when the pain starts to escalate. Notify your nurse if it feels like the pain medication isn't working. There may be side effects such as constipation, so please ask the nurse any questions that you have. If you have any questions on what the medication's for, what the side effects are, or how it should be taken, our aim is to manage your pain as best as possible so that you can sleep comfortably and participate in physical therapy while at the hospital. While you're in the hospital, the therapist will go over spine precautions with you to help protect your back or neck after surgery. The major spine precautions are no bending, no lifting, no twisting, or no BLTs. Before surgery, your doctor will fit you with a back or neck brace. The kind of brace you will use depends on the surgery that you have. Physical therapy will either be started the day of surgery or the day after surgery, and you'll have therapy twice a day while here. That will include making sure your body mechanics are correct when getting in and out of bed, getting in and out of a chair, as well as walking, and may include practicing stairs and getting in and out of a car. Their job is really to get you up, get you out of bed, and teach you the proper body mechanics, and to make sure you understand those before you leave. Occupational therapy is focused on activities of daily living, what we call ADLs. This will include bathing, dressing, and your hygiene. These are all things that you'll need to do when you're at home. While you're here, the therapist will introduce your equipment to you and give you instructions on how to use them. While here, you may use a rolling walker, crutches, or a cane. You may also use a bedside commode before you're able to walk to the bathroom. A therapist will work with you on using assistive devices you may need when you'll go home, so this may include a spine kit, a raised toilet seat, a bath bench or chair, and/or a handheld shower. Outpatient therapy may be ordered by your surgeon for you after you leave the hospital, and you'll be instructed on when you should start. This is usually about 4 to 6 weeks after your surgery and will include focusing on core stabilization, body mechanics, and how to build your muscles. Your surgeon will give you a referral for your post-op outpatient therapy. We want you to think about preparing your home prior to surgery. We recommend that you have a straight back chair with armrest. It should be stable, so it should have no wheels. You will not need a special bed. The bed that you have should be fine as long as it's not a futon or low to the ground. To prepare your home prior to surgery, make sure you remove your throw rugs, clear your hallways, identify barriers in the bathroom and kitchen, and check that your stairway banisters are solid. It may be a good idea to prepare some frozen meals in advance of your surgery and arrange for someone to care for your pets to make it easier for you when you return home. This should all be done before surgery or discuss with your healthcare team if you have questions. There are several options when it comes to transition home. Your surgeon will indicate what the most appropriate option will be, depending on your medical needs and insurance coverage. These options are acute rehabilitation, subacute rehabilitation, or returning home with the help of home health, or returning home with the help of a caregiver or coach. Some patients may go to acute rehabilitation. At Weiss, we have a great acute rehab unit right on the same floor that you'll be recovering in after surgery, if it's needed. For acute rehab, you would have to meet certain medical requirements, and it would have to be approved by your insurance. In acute rehab, you would receive therapy 3 hours a day, broken up throughout the day. Another option may be subacute rehab, or also referred to as a skilled nursing facility. Again, there would be specific medical and insurance requirements for subacute rehabilitation. If subacute rehab is indicated, we recommend that you visit the facility and make sure transportation is arranged prior to your surgery. Other patients may be discharged directly home with the help of a home health agency or another caregiver. With home health, a therapist and a nurse may come to your house. If ordered by the doctor, we can have this set up before you leave the hospital. Home health is for those who are safe to go home but who are homebound, meaning you're not able to leave your home without assistance. So a therapist or nurse will come to your home 3 to 5 days a week and give you the therapy that you need before you are ready to go to an outpatient therapy on your own. Other patients may be discharged to home with the help of their coach or another caregiver. The role of a caregiver or coach is really to assist you at home to make sure you're safe and stable at home. Dressing changes and anti-embolism stockings are something that a coach or caregiver can help you with, as this is something you may not be able to do on your own. It's also important because you may need help with daily tasks such as laundry and cooking, and the coach or caregiver will also observe you to make sure you're doing well and are safe. After you leave the hospital, you will need help with your dressing changes. Your caregiver should wash their hands before and after changing your dressing and use a clean technique. Instructions will be given to you at discharge, and dressing should be changed as directed by your surgeon. After you leave the hospital, if you have a fever of over 101, or if you have incisional redness, drainage, or odor coming from the incision, or severely increased pain that does not go away with pain medication, notify your surgeon. This could be a sign of infection. It's important that you follow your discharge instructions on caring for yourself at home for a better outcome. We will want you to change your position hourly. We need you to wear your brace as instructed and apply all your spine precautions to all your activities. We will want you to walk daily and steadily, increasing your distance as your body lets you, and have your coach around to help you. You should limit your stair use to 2 times a day for the first week at home. You'll receive home medication instructions and directions at discharge. Take your pain medication regularly and exactly as prescribed. Talk to your healthcare team about when you should decrease or discontinue your pain medication. You may be given stool softeners at discharge to help prevent constipation as a side effect of the pain medication. After you go home, you'll resume all your preoperative medications as ordered by the doctor, but you should avoid any kind of anti-inflammatory medication per the orders of the doctor. This may include Motrin, Advil, or aspirin. Always talk to your doctor if you have any questions about medications. Some pearls of recovery to think about when you go home. You want to track and measure your progress each week. This could be an objective measure of how far you walk each day, or what your pain management is each day, and how your pain scale is each day. On a scale of 0 to 10, where 0 is no pain and 10 is the worst pain, keeping track each day of where your pain is and report your progress back to the surgeon. Resist the urge to hurry back to your usual activities. Protect your investment. Follow your spine precautions in all your activities to promote optimum healing. If you're a smoker, you'll need to talk to your doctor about how to stop or what to do prior to surgery. Thank you for taking the time to review the Spine Pre-Op Education course. If you have any questions about any of the course information, please contact your surgeon at the Spine Center or call me, Alan Given, directly at 773-564-5680.